Hello, my name is Savannah Carter, and I will be going over why health insurance should cover art and music therapy. Should healthcare cover art and music therapy, and even if it isn't available by the patient's prescribed therapist? Some might think, yes, of course. Others might think that isn't required, that the patient should receive art and music therapy. Traditional therapy should be enough. And others might think, well, what is art and music therapy? How does it work? Well, I'm here to inform and persuade you on why health insurance should cover art and music therapy. In this persuasive speech, I'll be informing you about the importance of art and music therapy and giving you solutions of why health insurance can cover art and music therapy and what therapists and counselors can do if health insurance doesn't cover art and music therapy. Moving into my first main point, what is art and music therapy? Art and music therapy is a creative practice for therapists and counselors alike to involve music and art in self-expression of patients and clients. It reduces stress, anxiety, as well as depression, and it also helps the clients express themselves in a new and different way. In the first academic journal called The Effect of Music Therapy on Hospital-Induced Anxiety, Health-Related Quality, it says that music therapy is considered as an alternative intervention to reduce the anxiety without any side effects. Sedative music has shown better improvements in patients who understand and underwent heart surgery. You might be thinking, what does this have to do with anything? Well, by the release of endorphins cause a reduction in calamine releases which makes patients' blood pressure go down instead of rising. Sounds amazing, right? But the only thing is, some health insurance companies don't cover art and music therapy unless the therapist that your healthcare provider is sending you to understand or practice art and music therapy. Well, luckily, this isn't the case in some health insurance, but what if someone has government-issued health insurance that doesn't see art and music therapy as a necessity? All health insurance, including government-issued health insurance, should cover art and music therapy, especially when there's children involved. This form of therapy is great for not only just for adults, but also children and teens, especially children and teens that don't know how to express themselves using words, but can express themselves using music and art, and even like creating like a sculpture or playing an instrument, or even just painting in different colors to express how they feel. In my second academic journal called The Art and Music Therapy with Adopted Children Under 5, it explains that there are particularly helpful interventions when children and young people are unable to understand or explain their feeling using words, and provide a means of communication and addressing emotional issues which may be confusing and distressing. And they also explain that is a non-reliance on words, meaning that the children can use music to display their feelings to another, which the therapist can help them to think about during the creative process. So if art and music therapy have all these properties that can help adults, children, and teens, then why isn't all health insurance covering it? Moving on to my second main point, creative therapy such as art and music therapy also can be form of non-threatening therapy for patients that have experienced severe trauma as well as PTSD. And if all therapists and counselors were required to have this practice of creative therapy, it could also help with the issue of patients having an option of receiving creative therapy such as art and music therapy. Which brings me to the academic journal called Using Creative Arts in Trauma Therapy. The Nuances of Healing explains that these therapeutic activities can alleviate or diminish the effects of the traumatic experience by creating corrective experience, allowing clients to lead a more productive life. Creative therapy has amazing healing properties for patients, but some health insurance, like government-issued insurance, sees it as a luxury and not a necessity, which needs to change in the eyes of some health insurance, especially the government-issued health insurance. Also in the academic journal, it says that further posited that use of creative arts helps the client reconnect explicit sensory and explicit memories of trauma, as these therapies provide a less threatening way for clients to tell their stories. So if all of these therapists and counselors have understanding of this field, then maybe health insurance can cover it. Because if all counselors and therapists have an understanding in creative therapy, they all can provide this service for all that's in need, and the health insurance will have no choice but to cover it. I would also like to explain the expressive properties it could have on family therapy, where words sometimes aren't enough and where you just need an alternative way of expressing yourself. In the academic journal called Musical Moments in the Creative Practice of Family Therapy, it explains that having the option of which instrument to pick loudly or play it loudly or softly, which combination of tones to select, gives everyone the capacity to express themselves freely and creatively. By being able to express yourself and how you feel without using words, it's powerful for families, kids, teens alike, and it helps them express themselves without feeling like they have to say a certain thing or feel a certain way. They can express themselves by playing an instrument as loud as they want or as low as they want, or pick whatever color they want the instrument to be. Moving on to the academic journal called Moving On Creatively, Creative Assistive Therapy for Children and Adolescents. Explain there's an innate creativity in which has nothing to do with being artistic nor producing a product. There is no need to create or play with the goal of producing something. It is the process of creating that is important. When I read this, I instantly felt a connection because I'm currently a psychology major and I want to build a creative approach to psychology and therapy by being able to connect to my patients in a creative way. So moving on into the academic journal called Sometimes Words Just Aren't Enough. Enhancing the contribution of children, it explains that a challenge for therapists when working with children and their families is finding creative ways to support the child in sharing his or her story. There are many wonderful creative focused therapies that help through children through play, art, special language, and make-believe. Referring to this, it begs the question if all therapists or counselors in this line of work have to have some sort of creativity in their practice. When I become a therapist, I would like to deal with people of all ages and mentality. I want to work with people and get to know them in a creative way. I want to use music and art to be able to connect with my patients and to get to know them mentally through their work. So in conclusion, my solution to health insurance not covering all patient sessions is for therapists or counselors having a background study or practice in the creative therapy field. Because no matter where healthcare providers send patients, the therapist or counselor will have the tools to approach and help the patient. And the health insurance companies will be forced to cover sessions. So if we all band together and learn how to use art and music therapy in a creative way to help our patients, then we can help them. And health insurance won't be able to stop you on a trivial matter of not paying for this session or not covering the session. Thank you.